Hi, I'm Rod. Been with Mended Hearts since 2018, so it'll be
Fun.
Yeah,
Pre-COVID.
yeah, almost 5 years now, and I'm from Castro. I live in Castro Valley now. So.
How about there, back there? Could you tell us your name and how long have you been in Mended Hearts?
Mary Spain.
Okay.
Few months. Can't remember exactly. Okay, February.
All right, my name is Bill Spain. I'm married to Mary, and I'm her chauffeur, so I brought her down here today.
Thank you.
All right,
My name's Neil, and I think I'm about to celebrate my year anniversary with both my heart attack and this group.
And behind Neil is
I'm Sherry, and I've been with Mended Hearts since maybe. In January, I've had a gun.
ooh, all right. One of our tabbers. Okay.
Hi, I'm Julie, and I'm here as a guest with Anne. And I am, although I did have a heart attack. I can't remember what year, many years ago. And so this is very opportune for me to be here today. Thank you.
Welcome to the club.
I'm Anne, and I had a TAVR done in January also.
Oh,
And so I've been attending since I think sometime in February. So
welcome.
thank you.
Hi, I'm Gigi McQueen, and I had open heart surgery in 2019. And I actually became a member with Mended Hearts in about May of this year.
All right. Good. And she's going to be one of our speakers.
Yeah.
Okay, and I will sit down in the chair and lean in. I'm Laura. I've been in Mended Hearts since 2016. And May.
My surgery for a valve replacement in 2005, and I've been a member ever since. May 8th.
And John, you want to?
So I'm John Stansbury. I'm the Zoom Meister today because our regular Zoom Meister, Carter, is in Greece. So I got the, I want to say that we wouldn't be as far along as we are, but for the help of Neil, who introduced himself earlier and who's much more knowledgeable about Zoom than I am. So he took us through the rough spots. I don't remember how long I've been a member of Mended Hearts, maybe. Well, I was diagnosed with congestive heart failure 6 years ago, so it's probably been about 3 years that I've been a member.
And the six or the five of you introduce yourselves to the people who are here.
Okay, yeah, hi, I'm Sally Dowell, and I had mitral valve repair surgery in 2019, and I've been a member of the group since then, and I really enjoy it as this group provides chances for discussion and sharing ideas. I think it's great.
My name is Bill Dean. I had a quadruple bypass in 2011. Been a member of the Mended Hearts since 2011. As some of you know, or most of you know, Kathleen and I moved to Phoenix, Arizona about 3.5 months ago. And of course, we'll be probably participating in future meetings via Zoom. Both of us have been active in the chapter over the years.
Hi, I'm Kathleen Schultz. Bill kind of gave you our story. And so it's nice to see all of you, and we miss you, and that's it. I'm the caretaker, or the caregiver, sorry.
Caretaker is probably more right.
Right.
Hi, I'm Lorraine Schnoor, and I was a caretaker for my deceased husband. And we were life members of Mended Hearts, and I still attend meetings and find it helpful.
Sure. My name is Steve Gillian. I live in far east Contra Costa County. Had triple bypass surgery in April of 2019, and later that fall, I joined Mended Hearts. So it's been about 4 years. So it's nice to see everybody, and I'm grateful for these hybrid meetings, Laura.
Oh, good. Yeah, I am too. We'll keep working on it. Thank you. Okay. Hooray. Thank you all for being here. So let's carry on, shall we? Okay. I am going to read from Steve Malazia. Steve is in Arizona, and he said he wouldn't be able to be here today, but he really wanted to tell part of his story. So we had a couple of phone calls, and this is the amalgam of those calls. Steve Malazia's healthcare journey has been an exercise in exploration of alternative healthcare solutions. He despaired of his quality of life after he felt several of his American medical doctors, including his primary care doctor, urologist, cardiologist, were not working in his best interest. And his medical insurance was designed to extract cash and not pay for these other procedures that he wanted. His initial conditions were a blocked LAD artery and early prostate cancer. He asked a urologist at the San Ramon Medical Center about the latest information that a high dose of vitamin C was found to reduce cancer. The urologist laughed in his face and told him that he could pick one of 3 procedures for his cancer: surgery, chemotherapy, or radiation. Furthermore, the urologist said he wouldn't consider surgery for him until he resolved his blocked artery. Over 11 years, Steve has spent $250,000 trying to resolve his blocked artery. A stent was not possible. Steve found that the Sam Walters Clinic in Arizona used a Mayo Clinic approved treatment called PTX chelation. It is an IV drip for 3 hours, 3 days a week that removes the heavy metals out of the body and diminishes the soft plaque in his arteries all over his body. This procedure has made Steve feel better. He also has tried the PTX ablation, which is a new procedure that uses laser vibration to break up the hard plaque, which is considered impossible by other methods. Steve is grateful to our Mended Hearts programs, especially the ones about the connection between sleep apnea and our hearts. He took the test and found that he would benefit using a CPAP machine. He also was impressed by the cardiologist speaker who explained about the LDL particles that need monitoring for a more accurate assessment of cardiac risk. Steve has made a wonderful contribution to our group as membership chair. He was able to assemble and reorganize our records after Mended Hearts National systematized their own. When I asked him what advice would he give to others, Steve said, to be your own advocate. Do enough research on your own to have meaningful questions for your doctor. He also said to look at other places beyond the US for new treatments. Although he thinks American medicine is awesome, it is not an 100% solution for everything. He hopes we will not be closed to other treatments that are out there in Europe, Greenland, China, New Zealand, and Thailand. So, thank you, Steve.
Interesting.
All right. Steve or Gigi, which would you like to go next? Oh, okay, Gigi?
Yeah, come on up here.
Take it away.
So my name is Gigi McQueen, and this is my heart story. For me, the first thing I had to do was actually forgive my primary care physician because I no longer trusted her as a doctor. Because it was October 3rd, 2019, and I was having open heart surgery. Less than 2 weeks after celebrating my 48th birthday, 6 months after having a stent placed in my left circumflex artery, which had an 80% blockage, and almost a year later at being told that the chest pain that felt like a block of ice on my chest and the shortness of breath that I was experiencing was heartburn. I no longer trusted her. I questioned, doubted, was leery, I was pissed off, I was confused, I was anxious, and I was scared. This was me 2 weeks ago. September 21st, 2019. I am celebrating my birthday with my friend Jeannie in San Francisco at the Gilmore. I couldn't quite jump because my chest pain was hurting, but I was moving the best that I could. I was just having a grand old time. However, leaving the event that night, I was having severe chest pain that my friend Jeannie encouraged me to follow up my cardiologist to see what was going on. And 6 days later, I was rushed in the ambulance to San Francisco Kaiser, and I was told I needed to have open heart surgery. At the time, it scared my parents, my sister, my best friend, just because I didn't have a history of heart disease. No one we didn't have a history of having heart disease. I exercised, I was a vegetarian. I did what I thought was maybe the right thing. Granted, I did have a little bit of chub on me, but other than that, I was pretty healthy. But emotionally, I had a job that I was extremely stressed and overwhelmed, and the environment was toxic. I was depressed, and I was dealing with, I had lost one of my closest friends, a relationship had ended. So several things that may have contributed to it. So after that, like I said, I was rushed to the hospital and I had open heart surgery. And at that time, I was told that my left anterior descending artery had a 90% blockage and that my right coronary artery, it was an anonymous one, and they had to do a reimplantation of it. It was a rare surgery. They had to actually reach out to Stanford University and get a second opinion because I was told that supposedly maybe only 3% of the population had this particular procedure. So it was rare. So this was kind of what I held on to. This during the whole procedure. And you guys can't see this, but this is my family. My mom and dad and my sister and my best friend. They supported me. Recovery took about semi-recovery. It took about 6 months. And my family stayed with me throughout the entire process, making sure I was good. They bathed me, they cleaned me, they did chores around the house. And I had to adjust my lifestyle because I no longer before I didn't have to take medication, but now I was actually taking 4 meds a day. And I couldn't do push-ups and certain things I wasn't able to do. So here it is, almost 4 years after having open heart surgery. And this is my passport. Going this travel. And October 3rd of this year, 4 years to the day of my open heart surgery, I'm going to Portugal. And I'm going to celebrate. So this is my family. I think for me, one of the I had to make changes. I had to get these Doritos. And I now eat this. zucchini chips. So just that. I think for me, there were a few lessons that I had to learn throughout the process is that I learned that doctors are humans. They make mistakes. Pretty much like Steve said, I had to learn to trust my instincts. And if you don't feel okay, get checked out. If you're still not feeling good and not getting the answers, get a second opinion, speak up and be persistent because that's what I had to do with my primary care physician. Be okay with advocating for your health. Listen to your body. And when you select a doctor, be sure you select someone who hears you and who works proactively to make sure that they specialize in being preventative. I think this for me. I don't know if it's.
Yeah.
Oh, maybe it just went out.
I think it's
Just
the.
projector.
Okay. Secondly, the healthcare industry in the US is great, but it's also problematic because for me, America is one of the richest nations in the world, one of the most richest and powerful nations in the world. However, not everyone has access to healthcare, and also to healthcare is not affordable for everyone. It doesn't make sense because I'm not trying to be political, but it doesn't make sense that someone can get a gun easier than they can get like good healthcare. And I feel that needs to be looked into. And there are certain things that I've experienced in healthcare, like the isms of classism, sexism, and racism, because I found it interesting that after I had my heart procedure, my primary care physician did apologize. And she said at that time, that heartburn was not considered an issue for women having a symptom of a heart attack. And now it is. Not saying I'm part of it, but there were other women obviously that were contributing to that discussion. And I don't think women are necessarily looked at more so maybe, as men with heart issues. And I think that needs to change. So I think that needs to change. I think I've learned to identify for myself who and what's important. I didn't necessarily I wasn't good at priorities. I really kind of wanted to please everyone, but I've had to learn to take care of myself. I've had to learn to listen to my body. I've had to select people around me who appreciate me and who celebrate me and vice versa. I've had to identify what's important and kind of create my own joy. And trust your body, listen to it. And then also lastly, I would say, when life throws you a curve, I find it's an invitation to throw a curveball back. So you have to decide what the curveball looks like. Like I said, heart disease wasn't in the picture for me, but after having heart disease, having open heart surgery, it's given me an opportunity to reevaluate my life and redefine what joy looks like for me. In 2022, I left my considered corporate job to take time off to rest, to heal, and travel. I've written a book of poetry, and I've started a stationery line. So like I said, when life throws you a curve, it's your opportunity to throw one back. You get to decide what that curve looks like. And I hope all of you stay encouraged through this journey. That's my story.
Oh,
Great, thank you.
Here.
Thank you, Gigi.
Thank you. Thanks for the opportunity.
What an inspiring story.
Yes, thank you.
Mended Hearts National is asking all of us to find people who have had the same heart problems and join together with them, not just in our chapter, but in chapters all over the country. And they've redone their website so that that's easier to do. So like if I were to type in stent, that would connect me with people in other chapters as well. So I thought that was an interesting thing that we were kind of getting to that ourselves. So, Steve, could you be our next speaker, please?
Yes, I'd be happy to, Laura, although what I'm going to say is relatively dull compared to what Gigi just said. Although, Gigi, I'm so happy to see your red heart pillow.
Oh,
Um, I got my red heart pillow at Sutter 4 years ago, and I kept it in my office here. I really liked it. And, obviously, when you're in the hospital, that has great meaning, and when you're out of the hospital, that that really helps in the recovery. But a few months ago, some of my grandkids were playing up in the office up here, and I haven't seen my red heart pillow since. So I'm not sure what happened to it. Maybe you've motivated me now to go look a little harder for it. But as I was thinking about what I might say, I was reminded that can you all hear me?
yes.
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 Okay. I was reminded that when I was a child, I had rheumatic fever. And I don't know a lot about that, but it can have, I guess, an effect on your heart. And growing up, I was always told that I had a heart murmur of some type and was never serious at all. But, years later, I wondered if that has some implication on my own heart story. And anyway, it was about 4 years ago, 4.5 years
I don't
ago.
need you. I don't need you.
I like to get out and walk quite a bit. And this particular evening, I was out walking. It was Easter weekend, and I felt some of this tightness, I think, in my upper body, left shoulder, whatever.
Hmm.
And I'd experienced that before. I didn't think anything of it. And fortunately, my son, who lives about 3 hours south of us, was visiting for Easter weekend, and he's a physician's assistant. A PA, and I was telling him the very next day, which was Saturday, what some of my symptoms were, and he advised me to go to the ER. And had he not been there and told me that, and because of our relationship, I probably wouldn't have gone. I just would have figured out it's just happening again, and it's not a big deal. But I took his advice and I went to the ER. I actually went to the hospital closest to us, which happened to be the Sutter Hospital, and they admitted me. Again, I apologize. It's 4 years ago, 4.5 years ago, so the details are getting a little fuzzier as I get older. But they admitted me, and immediately they had a cardiologist come in see me, who, by the way, is still my cardiologist today. So I think they ran some tests. They looked at me, and right then and there, I think is when they sent me down to Alta Bates down in Oakland, or something within like a day or two. They sent me down there. So anyway, went through all the procedures and tests and so on, and they basically told me we need to do a triple bypass, which was kind of a shock. But um, during my time in the hospital, and I cannot for the life of me remember uh, when it was, but Bill Dean actually came into our room. My wife remembered who it was specifically. I didn't remember. I just know we had a visit. And Bill, I can't remember to this day whether it was pre-op or post-op. But you came in and shared the information, and it was a good visit. So anyway,
Post-op.
was it post-op? Okay,
Yeah.
thank you. Your memory's better than I am.
But we
Mine
only
is.
visit, pretty much the visiting program is geared around post-op, not
Post-op,
pre-op.
okay. Thank you. Like I said, the details are getting fuzzier.
That's all right.
So we went and had the surgery, and of course, you don't remember anything about it. I remember waking up and thinking, "Wow, I made it." That was a good sign. Then it started to have complications. I mean, I guess my oxygen levels were quite low, and they were really concerned. And I remember the doctors and the nurses were in. I had the tube inside of me. They were very concerned. In fact, they told my wife that she should pray, and evidently it was pretty serious. But anyway, I remember in those days in ICU when things are really tough, I remember thinking, well, this could be it for me. You know, it was the first time I'd ever, in a very real way, faced the possibility that I might not make it. And this might be the end of my story. But thankfully, things worked out. The oxygen levels got stabilized. Ultimately, I got the tube out. I'll tell you that having that tube and I got a really weak gag reflex, right? So having that tube in there for 3 days, that I wouldn't wish that on anybody. Honestly, that was a very unpleasant experience. But anyway, after that was gone, then I started, recovering in the ICU and so on. And from my experience, the staff there in the ICU and the staff on the 8th floor were just magnificent. Some of the small things I remember is one of the nurses used to bring me some extra ice, which I really appreciated because, of course, you can't drink for a while, right? And then when I could start to eat drink, one of the other nurses was able to find me some extra popsicles. And that may seem like a small thing, but you all that have been there, that was a big deal. And again, it was kind of those small little touches that really endeared me to the nursing staff there. And of course, you went through I think I was there maybe a week or two in the hospital total, and just great staff. And finally went home, and that red pillow became so important to me, just, moving and getting up and down. Another little side note is that we had bought a, a new bed, a new mattress a few months prior to this. And we were buying it, and the salesperson said, "Do you want to buy this adjustable frame? The ones that go up and down." And it was like $300, and I didn't want to spend the money because I figured, why do we need that? But my wife prevailed, and it turned out that was such a good thing to have when I got home, to be able to get in and out of bed as I needed, because you could sleep sitting more upright. And had I not had that, it would have been much more difficult to get in and out of bed. So that was another little, I don't know what you call it, blessing along the way. So anyway, I went through the normal recovery process and started to walk little by little. Then I remember we had the compression socks incidents, and my wife, bless her heart, those things are not easy to put on. In fact, I couldn't put them on, so she put them on. It was hard. Maybe that's just one small example. She was a really great caretaker. She, get up in the middle of the night and, give me my pills every 4 hours and so forth. I think, a lot of the burden during that time was on her. But, long story short, things turned out well. I'm doing better, haven't had any problems. I see the cardiologist every 6 months, and things are good. So, like most of you, it was a real eye-opening and deep learning experience, right? Having never been through this before, you learn a lot about yourself, and you appreciate hopefully what other people do for you. So anyway, I guess that's my story. Not very glamorous, but I'm grateful for the things that I learned, and for all the many good professionals along the way who did such a great job in helping me recover.
Thank you.
Thanks.
I was just commenting on how Gigi was rooting for you in there with get those doctors to pay attention.
And everybody was sitting there, nodding their heads up and down, understanding what you were talking about, Steve.
Oh, okay, good.
Yes.
Okay, I am the last official storyteller for today, but we are certainly excited in hearing from everybody at one time or another. So I'll talk about learning that I had angina, and then my first stent, and then 7 years later having a problem with that stent. I missed all the warning signs, or rather, I didn't respond with knowledge of what to do after hearing the warning signs. You'll notice that at every decision point, I either made a mistake, but was saved by someone or something other than myself. My lessons learned are that I didn't really change my diet after the angina diagnosis or the first stent, and that I shouldn't wait to get help until it's an emergency. And actually, I didn't do so well at that. I had trouble with the medications for angina and cholesterol. I found I was not helped by any of the statins. And after 8 years of trying different ones, was overwhelmed by their side effects of brain fog, loss of cognitive ability, and screaming leg pains. I tried 3 different cardiologists who said it was statins or nothing. I found a rheumatologist for the pain in my legs who said, oh, he knew what it was that I was describing. It's statin-induced myopathy, meaning it was caused by statins. I had just heard of PCSK9 inhibitors from a Mended Hearts program on cholesterol called How to Prevent a Heart Attack. There was something more than statins. Thank you, Mended Hearts. I had fallen through the cracks in healthcare. I had timed out of both Cobra and CalCobra and needed a job with healthcare. My first heart attack was during a job interview in Austin, Texas. Most of the people I'd worked with in Menlo Park moved there. I flew to Texas and had scored a lunch interview the next day. During the interview, though, I noticed I could no longer understand what the interviewer was saying. I thought it was news. I was sweating, also not a good thing to do in an interview. I asked for ice and surprised everyone by putting it on my head. A stranger seated next to us ran outside and returned with a bottle of aspirin. He gave me 2 of them and said to chew them up and swallow them. He suggested calling for an ambulance, but I still thought I was in a job interview. The job interviewer drove me to an emergency clinic and gamely said we could continue there. It was packed with people lined up against the walls. I said, oh, I'll be right back, and went to the intake window and said, I'm having a heart attack. May I move to the head of the line? But I didn't think I was having a heart attack. I was just trying to be seen and then get back to the interview. They said an ambulance had been called since they didn't handle that type of emergency. When the EMT arrived, I tried to show him that I was fine, just fine. I stood up quickly and did a little shuffle step tap routine. But then I collapsed and said something like, that may have been a bad idea. They put me on a gurney and wheeled me out, attached me to an IV drip of nitroglycerin. The job interviewer said he had to go back to work, but would check on me later. You know, that was really sweet of him. And I slowly realized later that no company would want to hire someone who had just had a heart attack. 3 things happened in that hospital that I realize now were not standard operating procedures. One example, it's considered standard to check your blood every 4 hours for the amount of troponin, protein, that's only found in the heart muscles. If the amount of troponin increases in your bloodstream, it means the heart muscle is damaged and dying around the affected area, and the damage must be fixed quickly. One of the night nurses came in after midnight and said something like, your troponin numbers are very high. You should be moved into the cath lab, but no one is here. And no one is authorized to call the cath operator without authorization from the processing office. You haven't signed the documents. They don't get here until 8 a.m. I'm very sorry. After the stent was inserted, the removal of the stent line in the femoral artery was left to an intern with a nurse supervising. It didn't go as planned, and I bled out all over the bed, which wasn't found until later.
Oh.
It was 2009, and I was at St. David's Hospital, which is a teaching hospital. At that time, there were only two types of stents, bare metal and the newer and more touted drug-eluting stent. I got a bare metal stent. I had no idea that I was allergic not only to statins, but also Plavix, which is Lodipril, something like that. So the drug-eluting stent requiring daily doses of Plavix would have done me in. Thank you. Forward ahead 7 years to 2016. I was lifting heavy boxes at home before a planned window shopping trip to Sausalito. I was getting very tired, bending and lifting. I was sweating and groaning and becoming nonverbal. My spouse asked me where my nitroglycerin pills were. I had no idea. She called for the EMT. They arrived in less than 5 minutes. I felt like I was slipping away in the ambulance. The ER doctor and staff thought they had stabilized me in a separate room. Suddenly, I said, "Something's happening." Then loud horns were blaring. Everyone came rushing back into the room. The doctor jumped over the counter to get to me. My spouse was in the room and tells me the CPR looked quite horrific and not at all like on TV. The nurses took turns pounding on my chest for 10 minutes. My arms and legs were thrown up and out with the pressure on my chest. As I remained in cardiac arrest, the doctor used the electric shocks on me. Finally, I came back, pushed him off, sat up saying, "Who are you and what the hell are you doing to me? Where's Kelly?" As I looked around the room, one of the nurses said, "Follow my finger," and pointed. "She's right over there." Kelly was pushed up against the wall. The nurse explained that my language didn't bother her at all. In fact, it was good because they had noticed over the years that the feisty ones tend to make it back. The recovery statistic from CPR for my age group is 4%. We all waited for the intervention cardiologist or the surgeon cardiologist to drive over from San Francisco. Luckily, it was easier for him to come to Oakland's cath lab than for an ambulance to take me to him. My cardiologist told me she had liked what had happened. It was not just a heart attack or even a cardiac arrest. It was a coronary artery dissection. The stent had torn through one or more layers of the artery wall, allowing blood to pass through the innermost layer and become trapped and bulge inward. This narrows or blocks the artery and causes a heart attack because blood flow can't reach the heart muscle. The intervention cardiologist was able to reseat the same stent back into the artery wall. Unfortunately, SCAD, or spontaneous coronary artery dissection patients, have a high risk of reoccurrence and must reduce other risks for heart disease. At the time, I was a heart failure patient with an EF of 25. Normal is 55 and up. There was a page about mended hearts in the heart failure workbook with meeting times and place. I've been a member ever since. Thanks to Mended Hearts and the great resources it has uncovered for me. Thanks to the ER staff and doctor, the Alameda Fire and Ambulance people, the St. David's doctors and staff, my cardiologist, who said she was a unicorn because she was the only one on staff who would support a PCS canine product instead of statin. And thanks to my special caregiver, Ellie.
Wow, Laura, that's something.
Thank you, Laura.
Yeah. Well, anybody have anything else to say? May is raising her hand.
Name is May Ing, and I'm 77 years old now, and I had a heart replacement when I was 15, and then
Right here.
and then 2017 I had a heart attack. I had no symptoms, no chest pains or anything, maybe a little bit of short. But I called the paramedics. Luckily, when I collapsed, I had a phone. I called 911, and then I crawled through the front door so they wouldn't break my door down. And so when they came, I told them to keep the door closed because I had a cat. And then what happened was, I don't remember telling them very much, but I just wanted to point out that I had a medical bracelet, and I have on there that my Kaiser number, where I've gotten excellent care. And so I think that's how they knew to take me to Kaiser, because I don't remember telling them that. And then since I've been home, another thing that I wanted to point out is that I have I think it's a medical alert monitoring system. And these are the two things, well, they give you three things. This is a button, you can press if you fall. And then this is if you fall and you're unconscious, it'll also set off the alarm. And then there's also a bracelet. And so I use those when my husband is out of town or, whatever. I should probably wear it every day. And I also wanted to mention that I was diagnosed with sleep apnea about 2 months ago. I know people are hesitant to, wear the mask and all that, but actually now they have a nasal cap, which is pretty comfortable. You don't have to cover your mouth and your nose. And so I got used to it. It's comfortable. I'm finally getting a good night's rest. And so I think it's very important if you're having problems sleeping to be tested. And it's a very simple test. You just wear a bracelet for one night and then you bring it back, and then they can tell from that whether you had sleep apnea or not. And I think they told me I woke up like 40 times an hour or something. I don't remember, but now I'm down to like 2 times. So anyway, so I just wanted to say, give it some of the follow-up I'm doing.
Thank you.
Interesting,
You
thanks.
may. Very nice.
I use one of those nasal pillows as well, and it's been a game changer.
It's just nasal, like you should wear that mask. It's just a little cup that fits across your nose. And so you don't have to cover your whole face and your mouth. And so to me, it's more comfortable.
Yes, yeah, it's that's helped my sleep immensely.
Yeah. That just makes a difference.
So do you open your mouth and breathe through your mouth?
You can't, because that's another problem. You have to not breathe. Your throat gets so dry. And so actually, sometimes I tape my mouth, because they don't want you to breathe through your mouth, because it just dries out all the way down. It's very uncomfortable.
Yeah, that's my problem. I breathe through my mouth.
Yeah, that's the problem. Yeah. But then it helps, how the air comes in.
Yeah.
Yeah, that's a problem.
Okay, Laura, I'm going to rely on you to tell me when to stop recording.
Okay, well, I think we could probably stop now.